workers have reported waiting for up to 10 days for COVID-19 test results, and those in Gauteng say they are not alone. There are concerns that these delays could result in patients who should otherwise be self-quarantining to unwittingly be exposing others to the virus. Requests have reportedly been made to the National Health Laboratory Services to try to ramp up testing capacity. For more on this and the numbers, we're joined by Bhekisisa's Deputy Editor, Lopez Gonzalez. Laura, good evening and thank you for joining us tonight. The Minister of Health reporting 24,000 cases still unprocessed as far as the test for coronavirus is concerned. On the 1st of April, he said we had capacity to test 5,000 a day. With mobile units being put across the country, that could ramp up to 35,000. We have not seen that. What are we doing and what are we not doing?
Right. I think these are really good questions. So what we heard about a week ago was that our backlog in COVID-19 testing was sitting at about 96,000. And that's in large part due to a global shortage in the test kits and the materials we need to do the test. And that's why you're seeing healthcare workers wait very long times for test results to come back, and why you've seen a shift in the testing strategy in the Western Cape.
What is the most number of tests that we are able to do to date?
I think that's a little unclear at the moment. What we are definitely not being able to do is get the number of tests we need into the country. So last week, the National Health Laboratory Services did a presentation, another one of those late night briefings, and we're probably getting in about enough gene expert testing, so the sort of traditional lab-based PCR testing, in a week that we probably need in a number of days. So again, everyone in the world is scrambling for those test kits, for those chemical reagents. So it's quite a fight to get them.
How is that shortage of PCR tests affecting the numbers in terms of the daily infections that we're looking at?
So you're definitely seeing backlogs in tests, and as you said, healthcare workers are waiting quite a while. We just talked to a healthcare worker in the Eastern Cape who was a clinician. They had been waiting 12 days for their test results. We're not sure if they were still working, but obviously, if you're a doctor on the front lines, you need to know if you have COVID-19 quickly. And that's why the Western Cape has moved to limit who can get a test. So in the beginning, we started out very, very strict criteria. We broadened up. And now you're seeing at least the Western Cape, and I believe other provinces will follow suit, really narrow that down and really limit who can get a test.
In the last 7 days, we've done about 18,792 tests with a positive rolling average of about 7.7% or 7.4% in the last 7 days. Is that good?
I think it's certainly not anywhere what the demand is for. I think it's encouraging that the community screening, which has tested screened about 13 million people, is continuing to pick up relatively low levels of transmission in our communities. And that's why I think you'll start seeing the national testing policy shift to really focus on those at-risk groups. Because if you look at it, the Western Cape tests 9 people for every positive case it gets. In the Free State, you test 150 people before you get a positive case. So you're really starting to see that regional variation come out.
So why is that important, that relationship between the number of tests that we conduct and the number of those that are coming out positive?
I think that will begin to sort of guide what our testing policy looks like. So if you have to test 150 people before you get a positive case, it means that you're doing a lot of work for very little bang, right? But the Western Cape, you test 9 people to get a positive case. So obviously the burden is really high there, and you may start to see, testing supplies move around to try to address really high risk, high burden kind of areas. Again, like the Western Cape has already moved to say, testing is limited to over 55, people who are hospitalized, people with underlying conditions that put them at risk of serious COVID disease, healthcare workers, and people in old age homes. So again, really focusing on where we know the virus kind of takes off.
Now, going forward, what should be shaping South Africa's testing regime?
So I think that, certainly the experts are really sort of starting to kind of have a reckoning with this, right? We can't get the number of tests we want. So what do you do in the interim? There's a couple of different things that are going on. The country is moving to test new types of testing, sort of new manufacturers. Maybe if we get more makers of tests, we can get more access to tests. And SAPRA is still sort of validating and testing those tests out to see if they will work for South Africa. And then, recently in the Daily Maverick, we had experts kind of take a very radical sort of stance. And they were saying, listen, if you haven't processed a test within 3 days, that test sample is starting to degrade, right? So it's increasing the likelihood you get bad test results. Maybe we just chuck the ones we haven't done in 3 days and move on to try to get those priority tests through for populations like healthcare workers.
Now, if you look at the numbers, Laura, in the last 20 days or so, around the 14th of May, we were reporting daily cases of 665. That number shot up around the 29th of May to 1,837. It has come down since. I think yesterday we were looking at 1,455. Is there a relationship between that huge number that we saw around the 29th of May with the fact that when you've got a huge number of samples that are lying and that have not been processed, by the time you bring them into the system, you will see a spike in the numbers?
I think it's hard to say, but I think what people have kind of sort of been talking about is that those big jumps in cases are really coming from the Western Cape. And obviously, you're seeing there's quite a bit more transmission going on if you're seeing, for instance, that ratio of test to test positives that I talked about earlier. And that the Western Cape is kind of 3 to 6 weeks ahead of the rest of the country in the curve. So I don't think all of it is explained by, big jumps in tests or processing of the backlog.
Laura, appreciate your time. Thanks for joining us tonight. That is Laura Lopez Gonzalez, Deputy Editor of Bhekisisa. When we continue.